Hello guys, this is Dr. Possibility from Excel Academy. In this tutorial, I'm just going to explain my part 1 of birth defect. So please make sure that you subscribe to my YouTube channel and make sure that you register with Excel Academy. Let's quickly get started. The first question, we have been presented with this condition, and the question is, name the condition shown. So if you look at this condition is related to the what? To the tailbone which has been affected. And this condition is known as the what? Sacrococcygeal teratoma. What causes this condition? So this condition has two major causes. One, it is due to the primordial germ cells that fail to migrate to the what? Gonad region. Then two, the remnant of primitive streak. Those are the two causes of this condition. Let's quickly look at the next condition. So this condition is whereby there is an observation in the growth or in the size of the head. And this condition is due to the accumulation of the cerebrospinal fluid which has accumulated the head. And this condition is known as hydrocephalus. What causes this condition? One, this condition is caused by obstruction of the aqueduct of Sylvius, and this condition is normally related to X-linked gene. The next reason you can give is the abnormal accumulation of the cerebrospinal fluid within the ventricular system. Let's quickly look at the next question. So in this question, we have been asked to name the condition. So if you look at this condition is due to the loss of the what? Of the mesoderm in the lumbosacral region. So in this condition, you can see that the limbs have been linked together, or they have been joined. So in a case where the limbs have been joined together or fused, this condition is known as cyanomelia. And the causes of cyanomelia is one, the loss of mesoderm in the lumbosacral region, which has resulted in the fusion of the limb parts. Let's quickly look at the next question. So if you look at this question, we have been asked to state the name of this condition. So the name of this condition is what? Microcephaly. What causes this condition? So you find that this condition is due to the poor growth of the brain. And the poor growth of the brain can be due to what? The exposure of the mother to toxic chemicals or drugs such as alcohol. This is the reason why mothers or maternal mothers or mothers who are pregnant, they are advised not to take alcohol. So one reason is due to poor growth of the brain. Two, it is certain infection during pregnancy such as rubella. Three, exposure to harmful substances such as alcohol or toxic chemicals. Let's quickly look at the next condition. Name the condition shown. So this condition is known as what? Anencephaly cranioschisis. The reason why we are saying that anencephaly cranioschisis is due to the fact that the cranial region of the head is not closed. The neural tube did not close on the cranial region. And the reason why we have included cranioschisis is because of the fact that if you turn this child, you find that the upper spinal cord region is also not closed. As a result, this is anencephaly cranioschisis. Then, what causes this condition? So this condition is due to the failure of the neural tube to cross in the cranial region and upper spinal cord region. How can this condition be prevented? You find that mothers are also advised to take folic acid when they are pregnant. They take the folic acid just to prevent anencephaly and cranioschisis. So that folic acid, it will just help in the closure of the what? Of the neural tube. So the answer there is use of folic acid during pregnancy. The next question is name the condition shown. So when you look at this condition and the previous condition, you find that in this condition, it is only the cranial region which has not been closed. But in the previous condition, you find that both the cranial region and the upper spinal cord region were not closed. So since this one, only the cranial region has not been closed, the neural tube in the cranial region did not close, this condition is known as anencephaly. What causes this condition? So this condition is caused by the failure of the neural tube to close in the cranial region only. Then how can this condition be prevented? So remember that cranioschisis and anencephaly can both be prevented by advising the mother to take what? Folic acid during pregnancy. So, ladies and gentlemen, this was Dr. Possibility from Excel Academy. As you start your day, make sure that you are kind and you are good to others. Be the reason why others smile.